Canada's top doctor is giving advice on gathering for the holidays. Dr. Teresa Tam says people are getting together in larger numbers because it's the first holiday season without restrictions.
We can protect ourselves as we head into meeting with family and friends. So first of all, of course, get your vaccines up to date. COVID vaccine, if you haven't had it in the last 6 months or even a bit sooner, within 3 months, between 3 to 6 months. And also get your flu vaccine, because that is the virus that is circulating at very high rates at the moment. So that's the first layer of protection. Of course, stay at home if you're sick. Don't go to parties or to visit your older relatives if you're sick.
With me now is Dr. Dina Kulik, pediatrician and founder of Kid Crew Medical. Doctor, good morning. Nice to see you. Tell us what is happening right now with the respiratory viruses that we have been reporting on that are infecting and affecting so many children right now.
I wish I can say I've seen a situational change, but I haven't really. There's still very, very high numbers of kids that are sick with influenza, with RSV, with COVID, with other normal routine viruses we see this time of year. And in many cases, I've seen quite a few children that had multiple viruses at once, that had confirmed COVID and flu, for example, or RSV and flu if they've been seen in hospital.
Oh dear. So as we go into the holidays, a lot of people are very concerned about family get-togethers. Other people might think, well, kids aren't in school, so there's less transmission. What's your advice to parents as we get into the vacation period?
It's such a tough one because we've been home and in many cases not with our friends and family and loved ones over the holiday season. But I do caution you that with so many people that are sick, and certainly many people are sick for longer than you might expect, the idea that, if the fever is gone or we're not feeling as crummy, that we're no longer contagious, that isn't necessarily true. Many viruses are still being shed from our bodies, sometimes days, sometimes weeks after an illness. If you're coughing, if you're sneezing, if you have fever, if you have aches, stomach flu symptoms, sore throat, these kinds of symptoms, you likely are still shedding virus. So if you are going to be around loved ones this holiday season, I definitely recommend staying home if you are sick, masking if you're not feeling great, because at least that will help decrease the burden, decrease the risk of you spreading your virus to others, and being very mindful about who you're around this season. If you're around particularly high-risk individuals, whether they're immunocompromised or the elderly or the very young or any other significant risk factor, you do want to be open and honest with these individuals to make sure they understand the risk, even if you just have a minor cold.
Ontario's chief medical officer said that flu season has peaked. What's your opinion?
I hope that's true. They're going by research, by evidence of what's being seen in hospital settings. My version has been that viruses are still very much circulating. Most people are not tested, so we don't know exactly what virus a child has when they come to the office. You're only tested typically if you're admitted to hospital. So it is a bit of a skewed number. If we're seeing that the testing in hospitals are decreasing, that gives me a lot of hope. However, what I can say from my experience in the clinic is we certainly still have a lot of virus circulating, whether it's influenza or COVID or RSV, there's still lots going around.
And are families coming to you first and then you're recommending that they go to the hospital, or are they bypassing their family doctor and pediatrician and going straight there to emergency?
I hope people are only using the emergency room for emergency level care. The vast majority of children don't require emergency level care. If your child is talking to you, able to drink, is not losing consciousness, is able to keep fluids down, is not having trouble breathing, these are the kind of kids that should absolutely be seen by their primary care provider versus going to the emergency room. Unless your child needs emergency level care, please don't go to the emergency room. This is unnecessary. Please follow up with your primary care provider or walk-in clinic or other access point if you don't have access to your primary care provider.
Dr. Dina Kulik, thank you so much. Glad you could be with us.